There is a Barbadian saying, "What sweeten goat mouth does bunny tail," which truly captures the story of chronic non-communicable diseases like diabetes and their impact here in Barbados. Many of the things that we like to eat and do are having a negative impact on our health. With sugary treats and fried and fatty foods now a staple of the Barbadian diet, poor eating habits, coupled with increased stress and low activity levels, have now contributed to an increase in the incidence of these illnesses. In this series, you'll get advice on how diabetes can be prevented and controlled. Meet some of the experts working to care for diabetics here in Barbados, and hear from some of the NGOs and private sector representatives who are playing a role in the response, and hear firsthand from diabetics what it's like to live with the illness. In this first program, we'll learn what is diabetes and how it can be prevented or controlled, and hear about the work of the Diabetes Association of Barbados from its current president. Dr. Renee Boyce is one of the clinical medical officers at the Winston Scott Polyclinic's Non-Communicable Disease Clinic. She explains what is diabetes and who is most at risk.
Diabetes is a group of conditions where there is the body's inability to manage sugar properly. And the true definition is a lot more complicated than that, but that's the easiest way to understand it. In type 2 diabetes, let's talk about the pancreas. The pancreas is an organ within the body that produces insulin. Everybody has heard of insulin. What does insulin do? So insulin helps to keep the blood sugar levels where they're supposed to be. Now in type 2 diabetes, the insulin is produced by the pancreas, but the body doesn't respond to insulin as it should. Therefore, instead of the blood sugars coming down after you eat a meal, blood sugars tend to stay high, and then you get all the different problems that come with diabetes. So what fulfills the diagnosis of diabetes is the lab values you get back when you do your oral glucose tolerance test. The test is done in 2 steps. First, you come fasting, where you wouldn't have eaten anything the night before for about 8 hours. Nothing the morning of the test, so remember not to eat any sweets, don't suck any mints, anything like that. And then you get your first stick. The lab staff will give you a sweetened drink. It's very sweet, and it tastes better when it's cold. And you drink all of that, and then 2 hours after you have that test, you would be able to leave. So remember, it's 2 sticks, 1 fasting and 1 2 hours after the sweetened drink. Then the lab results will go back to your doctor, and he or she will then be able to decide whether you have diabetes or pre-diabetes. And they're very specific numbers because it's a difference between diabetes and pre-diabetes. The management is a little bit different.
Although there is a genetic link, diabetes has been proven to be mainly a lifestyle disease.
So you would find that in families where one relative has diabetes, there is an increased chance of another relative developing diabetes. And sometimes there are families where there isn't anybody who has diabetes, but some person does develop type 2 diabetes. And you would hear people saying that type 2 diabetes is a lifestyle disease. When we look around at our population, I mean, it's very heartening to see that there are more people now walking around, and you see them down on Spring Garden, you see them at the gymnasium, and that's very heartening. But there is still a significant proportion of persons who are running into the fast food restaurants, who are eating heaping servings of food. So those persons who do very little exercise, who sit down all day at a desk, who are overweight or obese, those persons are at risk for developing type 2 diabetes. Sometimes you've had diabetes for about 10 years and you wouldn't have known. But when diabetes becomes apparent, the symptoms are, for example, you find yourself being thirsty. You know, outside really isn't that hot. Thank God we live in a warm country. But you're thirsty all the time. You're just drinking and you're passing water frequently. Some people might connect the two. You know, well, I'm thirsty all the time and drinking more water, so maybe that's why I'm passing water. Another symptom of diabetes then would be consistently being hungry. And it's not just Bajan licorishness that we're talking about here. This is somebody, I'm really hungry. And then your friends and your relatives might look at you and say, but you're falling away though. But I'm eating, and I'm eating more than usual. So weight loss, even although you're eating as you normally do or even more, that's another sign of diabetes. And another symptom you can have would be changes in your vision. So as we all get older, we notice that it takes a little more out of us to read. So maybe the paper goes a little further back, but then you realize, no, my vision really is not what it used to be. And sometimes that's how diabetics are picked up at the eye doctor. If you've had a cut and this thing is not healing, you've had this cut there for weeks upon weeks, and some people call it a life sore. That's another sign that something could be going wrong, because diabetics do have a little trouble with wound healing. And another symptom, which is just very subtle, is that sometimes you just do not feel well. You're tired all the time, and doc, something is just wrong with me. I just don't feel like myself.
Your goal should be to be diabetes free, or to keep the illness under control.
And because it's a lifestyle disease, one of the things we have to do is try to change our lifestyle. And it's all well and good for us as physicians and nurses and people generally in the community to say you need to change your lifestyle, but it's not necessarily that easy to just get it one day and decide I'm going to change my lifestyle. Some people do, but it takes planning, it takes determination. So one of the things that we need to do first would be to try to exercise. And you don't have to go and join a gym if that's the type of personality that you have, where you need that rigid structure and so on. That's all well and good. Go ahead and join a gym. But in these economic times where money is a little tight, then get up and walk. I suggest to my patients sometimes, an excuse is, when I get home from work, I'm so tired and I can't do anything. Leave your sneakers at the door. When you get home, put your bag at the door, put on your sneakers, walk 15 minutes in one direction, 15 minutes back, and you have completed 30 minutes of exercise right there. If you, for example, walk to work and it takes you 20 minutes to walk to work, then what you could do is try, because it's going to be the same distance, but challenge yourself to say, okay, let me see if I can get to work in 15 minutes. I mean, you don't want to get to work smelling hot and sweaty, but you try to challenge yourself. You change your route. Try some hills, for example. And another thing is how we eat. Now, if we look at the serving sizes that we get in those styrofoam plates, they have different sections. And the section that should have the vegetables in it is the one that has the carbohydrate, the one that has the rice. Definitely too much carbohydrates. And I'm not a dietitian, but if you reduce the amount of carbohydrates, for example, and then increase the amount of fruits and vegetables and drink more water, it sounds easy. It's not easy, but it's possible. And once it's possible, it can be done.
The Diabetes Association of Barbados was founded in April 1975 by the late John Grace, Hugh Mapp, Dorothy Talma Montiel, Don Norval and Wilfred Ferguson to provide more information to persons living with diabetes.
Noreen Merritt is the first female president. She is a nurse midwife and a diabetes educator. She told us that the association offers screening, counseling, workshops for a small fee, and a monthly farmers market.
But part of what we do in this program is trying to get them to understand, not just to give them information. We want them to understand what diabetes is and what self-management means in terms of they taking control of what is happening, monitoring their blood sugars. We do a field trip, a supermarket field trip. We actually take them to the supermarket to read labels. And the last session is usually a cooking session where a dietitian, nutritionist, or chef comes in and teaches them how to prepare, in particular, vegetables, because most people will not eat vegetables because they don't like the taste. And I think it's probably because a lot of times we kill the vegetable and it has no taste, so we don't want to eat it. So everybody's talking about the cost of everything. A couple of years ago, we decided to do a market day. It was spearheaded by our office administrator, Stacia Brewster, and every last Thursday of the month, we had invited farmers to come to sell their vegetables to the public. It's not only people with diabetes. And we as an association, what we do, we buy the fruit so that we also can generate some income. But we try to sell to them as economical as possible, because you want people to be able to afford to eat sensibly. Too often, the psychological effects on anyone with a chronic illness is not seen or not addressed. And so when we see them in here, and I think they are more open because I guess we're not a clinical facility, so they are more open to talking to us about just about anything. And so we are able to advise them, you know, things that they need to be doing to reduce their stress levels. A lot of people, because of the stigma and discrimination associated with having diabetes, don't want anybody to know about it. But we try to let them know that they don't have to go on a podium and shout to the world that they have diabetes, but they need to share it with their family, their friends, their co-workers, so that if anything happens to them, it can be addressed. The other part to it also is that there are influential persons in the society who hide their diabetes. They are working, they are effective, they are productive, and I think they need to come forward to let people know, look, yes, I have diabetes, but I'm still functional. But for some persons, when they get diagnosed with diabetes, it's like a death sentence. I remember it being like a death sentence years ago, but I don't think it is anymore. Too much research and work has been done to improve the lives of people with diabetes for us to still be thinking in that manner.
Ms. Merritt encouraged persons living with diabetes to gain a full understanding of the illness to apply this knowledge to improve its management.
This is the out-of-control blood sugars that cause the damage to the system. Monitoring, there are persons who don't like to monitor their blood sugars because they don't like the finger stick. Some tell you they don't like to see the results. When it's high, it frightens them. But if you don't check it, you won't know what's happening. And waiting every 3 months to get your blood sugar checked in today's modern world is really totally unacceptable.
But not too many.
So I want to remind you that you need to wash your feet every day. It has to be done every day so that we can remove a lot of the dirt that has accumulated, a lot of the dead skin cells, a lot of the things that has been there that need to come off every day so that we can keep the pores open and keep the feet healthy.
Diabetes, like any other condition, needs to be treated holistically, and consideration should be given to the psychological effects of the illness. One of the complications of diabetes is diabetic foot. In our next program, Surgeon Selwyn Ferdinand will explain why for a diabetic, regular inspection of the feet is critical.
I use a simple term as an analogy. Babies rarely get any problems with their bottom because there is somebody who is changing their pamper frequently and looking at their bottom and inspecting everything every day. As a result, they are able to take action early to prevent problems. And so your feet become your baby when you're diabetic because you're looking for all the things that can go wrong. You're looking for signs of corns or calluses. You're looking for any signs of injury so that you can act early to try and minimize the consequences of failing to do that.
When it comes to your health, what you don't know can hurt you, and knowledge only becomes wisdom when you put it to good use. Remember to look out for the next program in this series and start taking control of your health starting today. Remember, don't let what's sweet on goat milk bun your tail. Join us again for another program. Thanks for watching, and goodbye.
Tune in and watch programs produced by the Barbados Government Information Service Sundays at 7:30 p.m., Mondays at 8 p.m., and Thursdays at 8:30 p.m. We welcome your feedback on our programs. You may email your comments to bgisfeedback@barbados.gov.bb. You may also view our website at www.gisbarbados.gov.bb or subscribe to our YouTube channel, the BGIS.